This author in Nature wrote that kickstarting successful vaccine manufacturing needs at least 4 key ingredients: financing in the hundreds of millions of dollars, expanded R&D capacity, government commitment to buy vaccines that are produced locally, and indeed regulatory bodies that meet international standards. This writer wrote that compared with other regions, African countries are lacking all of the four. What is your response?
African countries have all of the above, with the exception of the manufacturing of the ingredients. So what is missing in this equation is the manufacturing of the ingredients. And no country, no particular country in the world does all of that. China, India, Thailand, they all started off where we are today. And thanks to a political commitment and not just commitment, but the will to do it, they are there. I mean,
what are some of the most significant developments that you're seeing in the manufacturing sector that really gives you hope that we are on our way?
I'm very proud of what I'm seeing on the continent. Algeria, Morocco, Egypt, South Africa, Rwanda, Senegal, Nigeria, Uganda, Kenya, Ghana have all engaged and actively, and they are at very different stages there. So to an extent, I'm saying maybe the 20 years timeline was very generous. We could have tightened it to maybe 15 years and let it done. Now, having said that, we have to understand the market dynamics, that the arrangements that were put in place after the Second World War that centralized the health security apparatus of the world has to be reviewed. Okay, and very transparently and honestly. The arrangement about vaccine procurement is simple. Gavi is the sole vaccine buyer. They take money from governments and from foundations, give it to China and India to produce vaccines and then ship to Africa. We have to sit down and review that setup because it's part of the health security apparatus that I'm referring to and say, as companies are producing in Africa, how do we arrange ourselves so that you can buy from many more manufacturers in Africa? But regulatory, the African Medicine Agency is moving on speedily. If you bring Morocco, South Africa, Ghana, regulatory agencies, Tanzania, and a few others together, they give you a network. Okay, they give you a network. All you need is a political underpinning of them, that you empower these networks to be your regulatory body in Africa. A people of 1.2 billion cannot continue to mortgage their health security in the hands of others because of those kind of article like that says you cannot do this, you don't have this. We have all of that.